Welcome back. Joining us now is Dr. Kristen Comella. She's a world-renowned expert on regenerative medicine. She was named number 24 on the top 50 global stem cell influencer, number 1 on the Academy of Regenerative Practices list of the top 10 stem cell innovators. She has pioneered stem cell therapies from various sources, including cord blood, bone marrow, muscle, and adipose. That's fat cells. And what we saw last year, and I had Dr. Comella on last year, she was being attacked by the Department of Justice, the same people who just came out and said, we want to have indefinite detention without trial, the public. They were working with the FDA to make sure that you had indefinite prohibition of safe and effective treatments, indefinite prohibition of informed consent. So last May, the Department of Justice filed a lawsuit at the request of the FDA against stem cell clinics that were performing surgical procedures involving your own fat cells, taking out fat cells out of your own body and reusing them because they are regenerative. You just take them out, put them in a centrifuge, and that is now considered to be a drug. And I think it's, we talked about this because it's important that people understand how the government is shutting down your freedom preemptively. Now we've seen they're not just shutting down effective treatments, they're shutting down entire industries. A lot of people didn't pay any attention to the stem cell issue at the time. I did because I have family members who were doing that and needed that. But people just kind of looked the other way, didn't get any attention. We've now had a doctor in Wuhan. His name is Dr. Wu, and he's had some results from using stem cell therapy for people who had the COVID-19 virus, and he found it to be very effective. So I wanted to get Dr. Comella on, get an update as to what's going on, because she's not going down without a fight, and neither should you when it comes to this stuff. We all need to challenge these draconian authoritarian measures where the government tells us that we have absolutely no freedoms, no discretions, whether we're patients or whether we're providers, whether we're employees or whether we're businesses. They're shutting down the entire economy now. If you want to find out more about this, you can find it at mycellsmychoice.org. But joining us now is Dr. Kristen Comella. Thank you for joining us, Doctor.
Thank you so much for having me on again. Really anxious to tell the audience.
Well, I want to find out what's going on with this. But before we get into that, everybody's focused on the coronavirus, COVID-19. Talk a little bit about, kind of give us an overview as to what's going on from a medical perspective with this and how stem cells might have applied in this with Dr. Wu's research.
Yep. So on average, humans have about 5 viruses at a time in their body. So it's very common that you would be exposed to a virus. And the good news is that most of us have the ability to combat these invaders, these viruses, at any given moment. That's the nature of being human. We can coexist with microbes and overcome. When you first get exposed to a virus, there are a cascade of events that will occur. The first, and I like to think of viruses as little spaceships that land on the surface of your cell. And they will then inject their RNA or DNA into your cell and use the nucleus of your cell to replicate. So in the case of COVID or coronavirus, we're talking about an RNA that gets injected into the nucleus of your cell and begins the replication process. Your body is super smart. It has the ability to overcome. So in 97 or 98% of the cases of people who are infected with this virus, they will have no issue. They will overcome this virus just by utilizing their own immune system. A signaling process and a cascade of events will occur. This inflammatory response, which may include an elevated temperature, a fever, is what your body does to get rid of that virus, to flush it out of your body so that you can function normally. So the majority of the people who are exposed to this virus may not even know because their immune system functions properly. And
that's why we're seeing in the statistics coming out of Italy, 99% of the people had 2 or 3 different coexisting factors that were going to weaken their immune system, or they were elderly, average age of 79.5.
That's exactly right. And so it is in these small percentage of patients that have issues with their cardiovascular system, and in particular their lungs, that there may pose a problem. And the reason is because their lungs are already inflamed. So the aftermath of once the virus comes in is an inflammatory process, additional inflammation in your lungs. And when the lungs become inflamed, it makes it challenging for oxygen transport. So for this small percentage of patients that have additional disease, in particular cardiovascular type diseases, they could have a hard time breathing. And they develop something called acute respiratory distress syndrome. And what it means is challenging transport of oxygen in your body. So the way to combat that is to utilize ventilators and force oxygen through the system. And the reason that you can't breathe is because of inflammation. Mm-hmm. The fix is to bring down that inflammation. The smart way to do it is to utilize your own stem cells, which we know are anti-inflammatory, which we know can stop this overinflamed response and get the oxygen flowing naturally. So we could reduce the necessary time on a ventilator for the small percentage of patients to next to nothing. This is a quick, easy fix, and really a way to bring down the inflammation in a smart way. In fact, our team has actually published a study specific to using your own stem cells in lung disease, chronic pulmonary disease. And we've demonstrated amazing results. This is something that we should be doing right now.
Yeah, exactly. And, we look at these, again, we had Dr. Wu in Wuhan. He said, I did this with 9 people. He had a different stem cell. He took his from, I think, an umbilical cord or placenta. But nevertheless, they treated 9 patients. 100% of them recovered. And not only that, but it repaired the damage in their lungs, and yet we don't hear anything about that. We have even the malaria drug that's been around since 1944. We have Fauci pushing back on that, say, well, we haven't approved it for that use. And so we got this fight that's going back and forth because President Trump started talking about that. They immediately pushed back on that. But nobody's even talking about the stem cell situation. And this is something that you've already looked at.
Yeah, so we've treated over 10,000 patients with a strong safety profile. One of the reasons that this isn't being talked about is because it's not something that you can patent, bottle, and sell.
That's right. And we can see the attitude. That's right. And we can see the attitude of the FDA and the NIH and all of this, because even with this malaria drug, it's like, shut up. You're not going to talk about this, President Trump, says Fauci. We haven't approved it for that use yet. They want to have control over all these different things. As you pointed out, they've got another agenda. And they want to patent this. They want the big pharmaceutical companies to make money for it. So they don't want you to know about things that are safe, effective, and affordable. They really don't want to address the cause. We've even had the Goldman Sachs bankers talking about the fact that they don't want cures. They want treatments for chronic illnesses that are going to continue. They said that's not a business model if you actually cure the disease.
That's right. So we talked about this the last time I was on, but in 2017, the United States of America brought a lawsuit against me personally, as well as the clinic and the company involved. It said the United States of America versus Kristen Comella. And what they said is that the stem cells that exist inside your own fat tissue, your own body, are classified as a drug. And as such, we would not be permitted to assist patients in these surgical outpatient procedures to utilize their own stem cells. So this went to a federal judge here in South Florida.
Well, hang on. Let's pick up with that. We got to take a break, and I want to find out where this is in the appeals process because, folks, this is the other thing to understand. Not only do they have these bureaucracies out there saying, no, we will tell you what you can and cannot have, but they've also taken the unprecedented step to say that you cannot use cells from your own body to treat disease. And that's what this lawsuit is about. We've never seen the FDA assert that they have usurped that kind of authority. They don't have that kind of authority. They've never pretended that they do. But we'll talk about the lawsuit when we come back with Dr. Kristen Comella. Stay with us. Welcome back. We're talking to Dr. Kristen Comella. We just talked about the coronavirus, how viruses in general operate, how stem cells can be very effective in treating them. But because they are effective, I think, and many others believe, that's why the FDA has shut down Dr. Comella's stem cell that she had, the research that she had going. And of course, if you want to follow that and follow the case, you can find that at mycellsmychoice.org, because that's really what we're talking about here. And in this segment, I want to talk about the legal issues that she is now fighting, because she's now had to stop the treatments that were very safe, effective, and affordable, and now engage in a legal battle for your rights, not just hers, but your rights to have informed consent. And so, Dr. Comella, tell us where this case is. There is something that happened in the developments in another case that was somehow related to this, in the what they call our deference. It's the courts deferring to regulatory agencies interpreting their own rules, because they've been given the power to write laws for the rest of us that our elected representatives don't do. They basically create these agencies and let them write regulations without representation, just like they do taxation without representation. But tell us a little bit about where your case is and some of the things that have happened that apply to that in the appeal.
Yeah, just to be clear, U.S. Stem Cell Clinic is still operational and able to treat patients. We are just not able to utilize stem cells from fat tissue, which is what we found to be the most effective for patients. So we have to utilize. Are you still doing stem cell?
Are you still doing stem cells with other sources in terms of bone marrow and?
We are.
Cord. Okay, good. Mm-hmm. All right, that's important to understand. Okay, good.
It is.
But it is basically taking out your own fat cells, and which we all have far too many of, and putting them to good use by getting stem cells out of the fat. But tell us how the legal battle is shaping up at this point.
Right. So just to summarize, in the past, in 2017, is when the lawsuit was first brought against me personally, as well as the companies. And they being the FDA and their attorneys, the Department of Justice, gave me an opportunity to sign something called a consent decree, which essentially said that I would go away, stop utilizing these treatments for patients, and they would not bring the lawsuit. I chose not to sign that. I chose to move forward and fight for the right of patients to have their own cells and to use those as they see fit with informed consent. So in 2018, as we were preparing to go to trial, a federal judge in South Florida canceled the trial and awarded what's called summary judgment to the FDA, stating that they could seek that impermanent injunction against us, stopping us from doing the stem cells from fat. And she cited something called our deference. And this means that she gave deference to the regulatory agency to interpret their own regulations. And ordered the injunction. So the challenge... Yeah,
because you don't have any due process when the regulatory agencies come around. That's why they have civil asset forfeiture. They say, well, we can take your property without even charging you with a crime under the war on drugs. And that's basically what they did to you. They said, well, we got these regulatory agencies. They're able to do whatever. They write the rules. They enforce the rules. You'd have no presumption of innocence. You have no right to due process, including a trial, which you just saw.
Yeah, this is judicial bias in favor of the federal government and against the people. And in fact, Justice Gorsuch wrote an opinion regarding this type of ruling, saying that it's outdated and it's not something that federal judges should be referring to and citing. And in fact, at the same time that they brought a lawsuit against me, they also brought a lawsuit against a group in California doing similar procedures called Cell Surgical Network. And that case was also set to go to trial. And the FDA sought summary judgment in the same way that they did in our case. And the judge in that case, Judge Jesus Bernal, said that deference was not appropriate and that our judge had made a mistake and that this will go to trial. So I utilized the information and the opinion that Judge Bernal had given for my appeal. So I am now in appeal, and it will go before 3 judges, and hopefully the truth will prevail. And the rights to use your own cells as an American will be restored. You should be allowed to use the cells that exist inside your fat tissue. This should not be owned by a pharmaceutical company. These should not be packaged and resold to you. And I think this is a perfect time for Americans to realize the healing potential of these cells when we're dealing with chronic disease as well as acute disease, as is the case with COVID.
Yeah, absolutely. And again, I just want to stress for people how unprecedented this is. that when you were on before, we talked about how this is a far less complicated and invasive procedure than we have with in vitro fertilization. We have a lot of childless couples who decide that they will, take the egg and sperm from a mother and father, and they'll put them together in vitro outside the body and then reimplant that. This is not nearly as invasive as that. The government has never regulated anything like that. And just as we have people who will sometimes take eggs and freeze them and store them, you've got people who have stem cells of their own that they have stored for later treatment. And the government wants to stop that as well.
Yeah, as a matter of fact, the federal judge in my case at first was mandating the destruction of over 10,000 samples from patients who had stored their own stem cells. We filed the appeal and said we will not destroy those cells. So we were able to get a stay on the destruction of those cells.
Now, it's the mycellsmychoice.org. Is that where people can go to find information about where the case is? And do you have something set up there where they can help your legal expenses? Because this has got to be very expensive to appeal this.
Yep. So mycellsmychoice.org is actually a nonprofit that was set up for education. Right now, we want to educate the Americans about what's happening. We cannot utilize any of those funds for the legal fight. I've been personally funding those, the legal fight, and I've had some physicians who have been very kind and helped to donate towards that cause as well. But as you can imagine, fighting the federal government has been challenging for me financially. And I knew that. I knew at the moment that I decided not to sign the dissent decree, that this would be a bit of an uphill battle, but a battle that I'm willing to fight. And I know I'm on the right side of history.
You are on the right side of history, and you are on the right side of freedom. Even more importantly, the idea that the government is going to keep this under the table until we have some pharmaceutical companies that have come up with some kind of a patented process that they can sell us at an inflated price is just absolutely reprehensible when people are suffering with conditions that could easily be cured. And, of course, when we look at, again, going back to the chloroquine, I think is the way it's pronounced, the malaria drug, and the fact that they know that it's safe, but still the FDA wants to put a quash on that and not let people use that. When we look at the way stem cells are handled in Japan, they say, well, if you can show that this is safe, we'll allow you a certain number of years, and you can show if it's effective. But our government doesn't operate that way. It's absolutely outrageous to me.
Yeah, and we have 10,000 plus cases in the database demonstrating the safety of these products. I can't imagine what more you would need than actual human cases of these cells being delivered intravenously and demonstrating that safety. I myself have received multiple treatments of the stem cells IV, and it works.
Yeah, the FDA has basically stayed out of even regulating surgical procedures for various reasons. And then, of course, when people have surgery, things can go wrong. That's a part of the risk. But what you're talking about here is reusing your own cells, and you've got a long record of it not being dangerous, but you also have a record of it being very effective, and they want to suppress that. And we all know why they want to suppress that. It's absolutely outrageous, and we really do appreciate the fact that you are the David in this David and Goliath situation, taking this on. I think people really need to take a look at mycellsmychoice.org. Inform yourself about this, because there are safe and effective treatments out there that are routinely being suppressed by the FDA, and I think nothing brings that to light more than this dispute over a malaria drug. But the dog that is not barking in all of this is the other experiment that was done on a larger number of people to show how effective stem cells were right there in Wuhan. I mean, that's absolutely amazing. Dr. Comella, any other? Okay, we're out of time. Thank you so much for joining us. And folks, again, if you want to keep up with that and find out what is going on in that battle, mycellsmychoice.org. And we're out of time for today. Folks, this is another example of why we need to stop judicial supremacy. It is destroying this country. It is killing people. And it's not just judicial supremacy, but it's an out-of-control bureaucracy as well.